Thanks everyone. So that was the last of our 5 presentations for this evening, but we've now got some time for some questions. I'm sure there are things that have occurred to you during the course of the presentations that hopefully we can begin to investigate in a bit more depth. We've got a roving mic. These aren't for amplification, they just record, but it's always a bit confusing because you expect to hear your voice boom and of course it doesn't. So my colleague Nicola will come with the other microphone. And presenters, stay where you are, I will come to you. So has anybody got a question that would like to kick us off? Have you got a question?
I have a question. If it's
Lucky.
for Andrew, if he's willing to take one. From me. I just wanted to ask a bit about, you obviously started this interest in David Alawali through your work with Carol Phillips, and I wanted to ask about the creative process that was in terms of being an academic in the School of English and interested in literature, how that connected to the work around a historic or real person in the history of Leeds, and how you navigated that difficulty or that tension between the two.
That's a really. I found it a wonderful thing to do straight after my PhD. I've always kind of really liked historical research. I find it a relief sometimes to turn to the historical when you're kind of doing all the kind of literary interpretation. It feels kind of doable and practical, and it's something. So it was actually a really wonderful kind of moment for me to do that. So I don't really kind of think of it in terms of kind of posing kind of challenges or difficulties. There was a kind of freedom to it. I think it was, Carol Phillips, like a number of other writers, kind of produces kind of non-fiction pieces of literary prose where there can be reimaginings, and kind of even fictionalizations of particular encounters, but also quite conventional historical narrative moments. And it was really through interviews and also finding stuff for him that could feed those narratives. That's what was my role, and I found it quite easy, really, to hand that over. And I think also it's clearly a very kind of worthwhile kind of thing to do, just kind of spread the story to modern audiences.
Hi, I've got a question for Freya. Hi, I'm Rosie Hill from Sociology. I just wondered if you could say a bit more about what you envisage the Hub for Music and Wellbeing Research and Practice doing, and how your collaboration will continue through that.
This really came about very directly from the symposium, because people were saying to us, this has been great, we need more opportunities like this to connect together. Because during the workshops in the afternoon, we'd only just begun to start some really interesting conversations. We had different sessions where one was on how might practitioners and researchers apply for funding. We had sessions on what are the challenges currently to music therapy and to accessing music therapy, and there was one other session which I've forgotten, Angela, I don't know if you can remember. We just began to open up conversations, and we just ran out of time to continue. So it came partly through that line of we need to keep doing this, and somebody said, why don't you make University of Leeds a hub for these kinds of conversations? We feel as though, as researchers, we're only just beginning to scratch the surface of some of the research questions that we're interested in. We also saw immediately that there was a benefit to opening up from the different traditions that people were working within. So music therapists with their qualifications and their approach and their clinical practice, and arts for health who were practitioners who were approaching this feeling in some senses quite isolated or a little bit defensive about their approach as well. So there was some So there are a couple of moments, I would say, during the day where there was a little bit of, where's this going to go? And it all seemed to work itself out quite well, but it raised more questions than answered. So how can we actually move forward by combining these communities and perhaps working together to do something bigger? At the same time, we're working on a new master's program, which we're hoping will be a master's in music and wellbeing and practice research, and we want this to be co-designed with practitioners as well, and we need the entire spectrum of different sorts of music provision to be represented. So we hope that it will have a dual purpose, so that it will both research and pedagogy as well.
Again, a question for the first project that was presented, which I thought was, like all the other ones, was fascinating. You mentioned about the potential for crossover between music therapy and community music. Speaking as someone who lives in North Yorkshire and in their spare time is involved in community music, I was wondering, well, it seems to be kind of an obvious link to be making. What are the challenges, the impediments to that kind of co-working?
Time is probably the greatest impediment in terms of going out and doing our clinical work. Is just, for me, I'm flat out at the moment doing that, but I know that a lot of the places that I go into, community musicians also go into. So the schools I work in, we have live music now, we have people coming in to perform with and for the young people. And I'm just really keen that as our organisation expands, that we put feelers out so that we can work alongside people, talk about what's happening. We may be able to provide a role in terms of helping with reflective practice, picking up, if you've got a room maybe of people, carers, people with dementia, there may be one or two people in that room who could benefit from more intense therapeutic interaction, maybe a one-to-one session, which maybe can't be achieved by the musicians who are going in, but they're perfectly placed to flag that up. So I can see our organisation growing as a result of this collaborative project, keeping contact with the School of Music to keep a good research base there, and finding ways of working alongside and together with, because we all have a role to play. We're all working towards people's well-being. It's just that we've all got a particular way of doing that.
This is a question for Nick and Ali, really, about Converge. I was just really interested in what you were saying about balancing and respecting that kind of intrinsic benefits of the work and not so much kind of focusing on, getting this instrumental benefit straight away. And I was just wondering whether you see, or has there been any impact in terms of on a national scale, rolling out potentially projects that use the model, and is there an impact, or do you feel like it's quite a unique project? Or
it's thanks for that. We're developing it here in Leeds and in Newcastle. There's at University of Northumbria we're doing the same project. But to answer your question about, I believe passionately that actually if you engage people, particularly in the arts, I think, but also in other subject areas, that has all sorts of benefits that derive, that are often very therapeutic, but we're not addressing them directly. They're addressed through engaging in the theatre or the music making or learning. And so real benefit is coming from just the engagement, just being good at and doing and enjoying theatre or whatever it is. It's been a really important principle for me in the last few years of this project. I don't know if you want to add to that.
I think it's quite a temptation if you're working as an academic to say, oh, this is a great project, but let me make it into research somehow. But what I was quite clear to do was to think of this as a pilot, just to see how people would take it, and not to put the pressure on them to deliver something that I wanted to get out of it. But obviously still the learning is enormous for myself and for my students, and so how can we reflect that is maybe by referring to our own process of change or learning throughout conducting the course. But I think there is a job to be done with the consortium of partners across Leeds, also about researching the impact of having such an ambitious idea of having the four big institutions in one city collaborating on a project with service users.
Yeah.
So we're talking about that